Hello, I'm Dr. Ajit Pai and I'm a senior consultant in surgical oncology and robotic surgery at the Apollo Cancer Center, Chennai. I'm going to talk to you about an important aspect of gastrointestinal surgery for cancer. This is a stoma. So stoma, also known as a colostomy or an ileostomy, is an opening created between the intestine and the skin by the surgeon. So if it's in the small intestine, it's called an ileostomy. If it's in the large intestine, typically on the left side of the belly, it is called a colostomy. So these are done after curative surgeries for rectal cancer. So when you have rectal cancer, typically it presents a little advanced, what is known as stage 3. So you have to give radiation to shrink the cancer and make it smaller. Then you do a good surgery by lap or robotic, where you remove the cancer with all the nodes completely like a cylinder without spilling it, and you join the lower part of the intestine, the rectum, to the upper part, the colon. Now with radiation, we know that tissue healing is poor, so many people can develop leak. So the leak will cause the fecal matter, the stool, to come out of the intestine into the belly, and the person can become very sick. Sometimes they can even die. So to prevent this, all patients who have received radiation for rectal cancer, we put a bag on the intestine which is ahead, either in the large intestine where it's called a colostomy, or the small intestine. This ensures that all the stool is diverted into a bag till the healing has occurred of the region where we have operated. So about 6 to 8 weeks later, we confirm with the scope. We pass a lighted camera in and we look at the place we have joined. If it has healed well and the person is doing well, then we can close the intestine which has been open and drop it in, and normal passage of stool will occur. So this is a life-saving procedure which we do for all patients who have rectal cancer who have received radiation. Rarely you may have a person who comes with, say, a colon rectal cancer which is blocking the intestine at the time the person comes to the doctor. In such cases also, we will do a stoma to bypass the obstruction, let the stool come out, let the person recover. Then the person can have surgery done properly a few days later once he has recurred. Or if the tumor has ruptured, what is called perforated, and spilled stool in the intestine, which can happen if you have delayed your treatment for a long time, then we'll have to wash out the stool, remove the tumor, and the upper part of the intestine will be brought out as a stoma, the lower part will be closed. This is what is called a Hartmann's procedure. And then later on, after a few weeks, the surgeon can rejoin the intestine back. So a stoma is nothing to be worried about. It is a safe procedure which is done either electively, which means that you are knowing that you're going to have it before surgery, like for rectal cancer, or surgeon has to do it as an emergency life-saving procedure. It's easy to manage stoma because we have a lot of stoma appliances, and here at Apollo we have the stoma care nurses also who are highly trained to help you fit the bags. The bags are important because they do not spill, they do not leak, and they have charcoal filter so there is no smell. So typically if you wear a stoma bag, no one will ever have to know unless you tell them that you have a stoma. In most cases, the stoma is temporary. In some patients who have very low rectal cancer, which is coming right up to the anus where you pass stool, the muscles are involved and we have to remove the entire rectum with the muscle apparatus, and then you'll have a permanent bag on the left side, to the left of the belly button. So that is called a permanent stoma or an end stoma. In such a case, obviously we cannot reverse the stoma and you have to live with the stoma for life. But we have stoma support groups, and we have a well set up system where people will train you how to apply a bag, how to use a bag, even come home and teach you till you're comfortable. And many of our patients, I would say about 25 to 30% of our rectal cancer patients may require a permanent bag because the cancer is so low when they come to us by location, virtue of location, and these people are doing perfectly fine.